Everybody prepares for pregnancy and birth. But how many understand that preparing for postpartum, the period after you give birth, is very important for your reproductive health and whether you have an easy menopause or a very tough menopause period? Yes, you heard me right. So, in this video, let me tell you the importance of taking care of yourself after you give birth and 5 things that you can be prepared for postpartum. Hi, I am Saranya, the founder of Babypedia, a birth professional and a life coach for mothers. So, why is taking the time to heal after giving birth so important? Because in today's fast paced world and nuclear families, we see a lot of mothers start doing their daily routine as early as they can. Some drive their cars, go for shopping even within 1 week of giving birth, and we feel empowered by it. But let me tell you that healing is very, very, very important. Remember that your body took 9 months to go through this whole process. Giving birth does a total number on your body and on your mind. So you definitely need to give your body some time to recover, right? Any other type of a medical procedure, and we will give the person, we call them a patient, and we give the patient so much time to heal. We give them rest anywhere from 15 days to 45 days, but why not after giving birth? When you give birth, even if it is a vaginal birth with no stitches, remember that in your uterus, the point where the placenta detached will leave an open wound. And the wound can be almost 8.5 inches, that's almost 22 centimeters in diameter. Yes, it is a huge wound. And it is an open wound, so shouldn't it heal? Your uterus expands to 500 times its original size during pregnancy. So it is going to need at least 45 days to go back to that size, to go back to its pre-pregnancy size. All your organs have moved around, it's been squished, your hormones have all been going havoc, and after you give birth, your hormones are going to drop. So you definitely, and then you're taking care of a baby who needs you all the time. So shouldn't you heal yourself well? Yes, it is our responsibility to take care of ourselves. So let me give you a couple of pointers on what you can be prepared for after you give birth. Tip number 1, moving around is very essential to kickstart good healing. Whether you've had a vaginal birth or you having a C-section, try to move as soon as your doctor gives you the okay. Because when you get up and start moving, especially after a cesarean, it is going to ensure that you do not get any blood clots in your feet. It is going to help you kickstart digestion and increase the blood flow to your body. All this is going to help you to kickstart your immunity and start healing your body after giving birth. You don't have to walk for a long distance, just inside your hospital room, just even 20 to 30 steps slowly is good. You can make it a pattern where every time before you breastfeed or after your breastfeeding session is done, you take a walk around for 30 to 50 steps and then you come back and you can take rest. The second thing, even if you've had a vaginal birth, you may have stitches in your vagina. Yes, you heard me right. Stitches are not only for C-section. You have stitches even after a vaginal birth. Especially in a country like India, where almost 90% of women, especially for their first births, are given episiotomies. That is, their vaginal muscles are given a cut, a surgical cut, and it will automatically be stitched after you give birth. So it can be difficult to sit and breastfeed your baby for long periods. You can use a soft pillow, a cushion. You can roll a blanket into a round donut shape and you can sit on it so that it reduces the pressure to your perineum or your vaginal muscles so that it can heal. Also, whenever you are going to urinate, it can be burning because of the stitches. So while you are urinating, pour some warm water onto your pelvic floor while you are urinating. Next, breastfeeding can be very easy peasy for a lot of mothers, but it can be equally tough for some. The way you hold your baby, positioning your baby, confusion whether your baby is getting enough milk. It could be painful. You could have, sore nipples, bleeding nipples, a lot of backache from not, sitting properly and feeding your baby. Breastfeeding can be confusing if you have a baby who keeps crying around the clock. So it is essential that you get informed and prepare for breastfeeding during pregnancy itself. Learn different ways in which you can hold your baby. What are the cues that indicate that your baby is getting enough milk? And then how to know whether your baby is latching, that is opening their mouth and holding onto your nipple well and drinking milk, or holding onto your breast well and drinking milk. All these are different things that you will need to prepare for during pregnancy itself. Let's talk about diet. Many times after giving birth, a lot of women are confused on what they should eat and they shouldn't eat. The same relatives and well meaning friends and family who offered them everything possible during pregnancy now will put a very strict restriction on your diet after giving birth. Remember, your body is healing. Your body needs to have a lot of calories and nutrients to be able to heal well. So, though there is no restriction on the type of food, initially, because all your organs have been displaced and going back to its position, digestion can be slow. So, start off with easily digestible food that is rich in fiber. The fiber will ensure that you have good bowel movements and you are not constipated after you give birth. And then slowly, day 3, day 4, you can add on other types of food. In case you see that your baby is reacting to any type of food in your diet, you can eliminate it for a few weeks and then try to reintroduce it again into your diet as your baby grows. But other than that, follow the normal precautions. No uncooked food. Try not to have too heavy food, too oily food. But otherwise, you can eat everything that you feel comfortable with. It may seem like a lot, but finally, I would like to tell you, this too shall pass. It feels like your whole life is totally gone havoc, but give it some time, 3 months, and you will be back on track. Remember, your body needs a minimum of 45 days to heal, irrespective of the type of birth, whether it was vaginal or cesarean. So take all the rest possible, get help from as many people as possible, and ensure that your body is recovering well so that you can take care of yourself and your baby lifelong. I hope this video gave you a lot of information. If you liked it, don't forget to press the like button, share it to another mother who is pregnant or is postpartum, and subscribe to the channel for much more informative videos. Take care. I will see you soon. This is Saranya.